The Affordable Care Act is doing what it's designed to do: deliver more choices, better benefits, a check on rising costs, and higher quality health care. That's what it was designed to do, and we're already seeing those effects take place. Now, I mention all this because yesterday, despite all the evidence that the law is working the way it was supposed to for middle-class Americans, Republicans in the House of Representatives voted for nearly the 40th time to dismantle it. We've got a lot of problems in this country, and there's a lot of work that Congress needs to do. Get a farm bill passed, get immigration reform done, make sure we've got a budget in place that invests in our children and our future. And yet, instead, we're refighting these old battles. Sometimes I just try to figure out why. Maybe they think it's good politics, but part of our job here is not to always think about politics. Part of our job here is to sometimes think about getting work done on behalf of the American people, on behalf of the middle class and those who are striving to get into the middle class. And so the progress that we're seeing in California and Washington and Oregon and now New York, that's progress that we want to make sure we're seeing all across the country, because there are still millions of people out there who not only want to get health insurance, but many who have health insurance who deserve a better deal and deserve the kinds of savings that the Affordable Care Act will offer. Now, if you're one of the 85% of Americans who already have health insurance, could be through your employer or through Medicare or through Medicaid, you already have an array of new benefits in place. You don't have to wait until October 1st. You're already getting benefits even if you don't know that it's because of the Affordable Care Act. You're getting better protections. You're getting more value for each dollar that you spend on your health care. And that last point, the issue of getting better value for your buck, is what I want to focus on today. For years, too many middle-class families saw their health care costs go up and up and up without much explanation as to why or how their money was being spent. But today, because of the Affordable Care Act, insurance companies have to spend at least 80% of every dollar that you pay in premiums on your health care. Not on overhead, not on profits, but on you. Now, many insurance companies are already exceeding that target, and they're bringing down premiums and providing better value to their customers. But those that aren't now actually have to reimburse you. If they're not spending your premium dollars on your health care, at least 80% of it, they've got to give you some money back. Last year, millions of Americans opened letters from their insurance companies, but instead of the usual dread that comes from getting a bill, they were pleasantly surprised with a check. In 2012, 13 million rebates went out in all 50 states. Another 8.5 rebates are being sent out this summer, averaging around $100 each. And for families like Morgan's that are working hard, every dollar counts. It makes a difference. As she said during her introduction, she'd been buying insurance on the individual market in Maryland for years. After she got a rebate for the first time, and I'm quoting Morgan now, she said, "It felt like someone was actually being held accountable for the dollars I was spending on health care."